Good afternoon, everyone. I'm Winny Aditya. I'm looking forward to talking with you today about blood cancer and blood smear also. Have you ever heard of blood cancer and blood smear relevant? Okay, today I'd like to discuss about that. So let's start. First, I'm going to present blood cancer. What is blood cancer? A condition also known as hematologic malignancy and the main effect of blood, bone marrow, or lymph nodes. Normal blood production and function is typically improved by uncontrolled growth of an abnormal type of blood cancer. There are three main types of blood cancer. I will begin by discussing leukemia. A type of cancer found in your blood and bone marrow is caused by the rapid production of abnormal white blood cells. There are four broad classifications of leukemia: acute lymphocytic leukemia, acute myelogenous leukemia, chronic lymphocytic leukemia, chronic myelogenous leukemia. Who is at risk of? Exposure to high level of radiation, repeated exposure to certain chemical, for example benzene, chemotherapy, a strong family history of leukemia, and the last Down syndrome. Am I at risk? The exact causes of lymphoma remain unknown. However, the following factors increase your risk of developing the disease: older age, male, Caucasian, having an autoimmune disease, HIV/AIDS, diet high in meat and fat, being exposed to certain pesticides. Symptoms of lymphoma include following: swollen lymph node in the neck, armpits, or groin, fever, weakness and fatigue, weight loss, sweating, difficulty breathing or chest pain, itchy skin, and rash. Okay, this layout of this number of lymphoma in the neck, right? And that's stage 1 until 4 of lymphoma. Okay, the next myeloma. A cancer of the plasma cells. Plasma cells are white blood cells that produce disease and infection-fighting antibodies in your body. Am I at risk? Sign of Signs and symptoms of myeloma include the following: hypercalcemia, anemia, renal damage, susceptibility, osteoporosis, bone pain, bone swelling, or fracture, high protein level in the blood and or urine, weight loss. Okay, the next I'm going to present blood smear of film. Okay, definition. The glass cell on the which doctor look at the blood cells under microscope to determine if their appearance and number are normal. A blood smear is a diagnosis procedure used in the evaluation and diagnosis of a variety of medical conditions. It is a standard procedure that if doctors suspect disease or infection, a blood smear is typically the first diagnosis task to be performed. Okay, during a blood smear, laboratory technicians will examine the three main components of blood: red blood cells, white blood cells, and the last plasma. A blood smear is an integral part of the diagnosis process. In fact, almost every practice will require a blood smear. However, some of the most common reasons why a doctor would request such a procedure are to identify the reason why a person is experiencing anemia, jaundice, apnea breathing, bone pain, rashes, infection, weight loss, and or recurring flu symptoms. Some of the most common type of medication that will give test results are anticoagulant and medication for other diseases. Okay, the next, how does the process work? First, as a part of the preparation of dosage from a push gas object or preparation glass, use must be cleaned from dirt and given the label contains information about the patent's name, date of manufacture, and the identification code of the patent. Next, one drop of the blood of the victim is applied on the preparation of the glass. This preparation, the other is used for leveling the blood into a thin layer or monolayer that can be observed under the microscope. Okay, next the glass clip is put in the front of the drop of blood, then pulled to the rear until the blood is evenly distributed on the every corner. At the final stage, the glass does pushed forward with an angle of 45 until 60 degrees to form smears along 3 or 4 centimeters. Like the blood is left to dry in the air before process of the staining. Blood cells should be colored in the advance so that can be observed under the microscope. This type of staining is most often used for examination for the blood staining Romanowski such as Reich, Grunwald, and Ginza. The first component of the blood will have a different color under the microscope. Furthermore, the preparation of blood colored will the glass coating that can be started in the long time. Okay, next observation under microscope is generally carried out the magnification of 40 times and sometimes 100 times. In addition, to calculate the number of white blood cells are consist neutrophil, lymphocyte, basophil, eosinophil, and monocyte. And says red blood cells and what should also be observed and reported to patient or physician relative. Examination of smear of blood. This is one of the initial examination to detect the cancer, anemia, and genetic abnormality like thalassemia. Okay, this smear, blood smear, ada this erythrocyte, thrombocyte, neutrophil segment, beta retinopathy, lymphocyte, monocyte, and basophil. This is thin smear and thick smear. In human blood cells, right? Platelets, red blood cells, like this. Okay. And then white blood cells, basophil, and white blood cells, not. Okay, that's all I have time for. Thank you for listening and watching. Bye bye.